Welcome everyone to the Canadian Nurses Association's webinar series, Progress in Practice. This webinar is about the revised community health nursing standards and what you need to know. The session is being recorded for nurses who are unable to participate today. My name is Aidan Hamza. I'm a policy advisor at the Canadian Nurses Association, and I'll be hosting this webinar. At the end of the presentation, we will answer your questions, which you can type in the Q&A box that you see to the right of the slide. We will address as many questions as time allows. The certificate of participation will be emailed to you along with the link to the recording of this webinar. And now a little bit about our presenters, Aliyah Dasani and Ruth Schofield. Aliyah Dasani is an associate professor in the School of Nursing and Midwifery, Faculty of Health, Canadian Education at Mount Royal University in Calgary, Alberta. She's also an adjunct associate professor in the Department of Community Health Sciences, Cummings School of Medicine at University of Calgary. She holds a PhD from the University of Calgary with a specialization in population public health. Her nursing practice includes instructing students in the Bachelor of Nursing program, population public health, community health nursing, and legal issues in nursing. Her work focuses on maternal, newborn, and child health. Her research interests include working with at-risk populations through community-based programs and interventions. She also shares a passion for global health issues. Ruth Schofield is an experienced nursing professor in community health nursing at McMaster University and Western University. Her research activities focus in community health nursing, nursing education, and mental health and housing, with a number of peer-reviewed publications. Ruth has over 23 years of public health nursing practice in frontline and management positions and in various programs. She has been a chair or general member on several provincial and national boards. She has led several national research projects in the development of the CHN standards, competencies, and educational guidelines. In addition, Ruth co-authored a chapter in the Community Health Nursing, A Canadian Perspective, 4th and 5th edition. Now I'll hand this over to our presenters.
Thanks, Aidan. It's Ruth Schofield speaking, and welcome to those that are joining us for this webinar. I hope you can hear me okay. Bear with me, I have a little bit of a sore throat, but I trust that you can hear me. So yeah, moving on, I believe we have a poll soon. We can just, or I'll go into the, Please respond to this poll that you now see on the screen, and you can just enter your answer. I'm assuming that's happening, Aidan?
Yep, we're receiving responses.
Awesome. Okay, great. So that the answer, the response to this will be seen for others as well to give us a sense. So we'll just bear with us as we get a sense of what people are aware of in terms of the standards. Thanks, Aidan. And there we are, which is very good. We do have 80% of you that are on the webinar. And we certainly have a large number attending right now. We're thrilled to see that over 80% are familiar with the standards, which is wonderful. So moving on to the next slide, the objectives for today are, obviously we're going to talk about how these standards are supporting excellence in community health nursing. And what we're going to look at is in terms of describing the need and the process that we went through for the revisions, discuss some of the changes, some examples of how they can be applied, and that this particular presentation can be used as a tool to describe community health nursing practice for other nurses in community health nursing. Other disciplines can be used for orientation, for continuing education and awareness with undergraduates. So it has multiple purposes that we will be exploring further. So I'm seeing the poll. Can you remove the poll on my screen? Thanks. And moving on to the next slide. So just a little bit about Community Health Nurses of Canada, if you're not familiar with it. We are a volunteer National Professional Association. We represent community health nurses in Canada in a variety of practice roles. And CHNC, which is the acronym we're known for, advocates for and strengthens the practice for community health nurses across all sectors, and obviously related to health. And so that is our primary focus. We are one of the specialty groups with CNA as well. Next slide. So when we think of community health nursing, we've pulled through, as you can see, three of the probably largest areas in community health nursing, which doesn't mean we've captured them all, but these are the largest in terms of critical mass. We don't have good numbers, so I can't give you the exact numbers, but at this point, these three areas, public health, home health, and RNs in primary care. Now, the standards in the past, up till 2011, really only focused particularly with public health and home health. However, RNs in primary care, we're keen to really get a presence as well. And we're considering certification, but because their critical mass is small, and they looked at our standards and they said they could really fit, it made sense for them to be integrated. And because, as you know, the standards are very much inform certification with CNA, then it made sense that they become part and be recognized. So when we looked at the standards in the revisions, these three groups, along with other areas of nurses in the community, they would apply to any nurse in the community who is promoting health with individuals, family groups, populations, communities, and systems. Next slide. This particular slide is a nice visual representation of the unique characteristics that is a really helpful tool to use when you're trying to describe the scope of practice of what nurses, community health nurses do, where they are involved, their view of health, their autonomy, and it can be continuous or episodic. And some of these foundational aspects of involving resources, a unique understanding in environment and context, relationship building and caring, and the whole nursing knowledge, public health, experiential knowledge that informs the characteristics of community health nurses. Next slide. In this slide, there's actually another visual in the standards, and you will notice it in the appendix. So I'd suggest that this is a modification of that, but there's a more clear one that you'll find in Appendix H in the standards. But what this is attempting to show you is the relationship between standards and competencies. We often get questions that nurses have is, what's the difference between a standard and a competency? And oh my, we've got so many things we're accountable to. And so the standards, as you can see, are considered, first of all, the blue circle is provincial and territorial standards. But so those are the standards that all of us are accountable to by our regulatory body at the provincial or territorial level. And standards are considered expected practice or scope of practice of, in this case, the blue circle, all RNs. And we are talking RNs at this point. We're not talking RPNs or LPNs. And so the orange are what are the expected practices of community health nursing. That's a typo. It shouldn't be CHNC. It should be of community health nurses. And CHNC is obviously written the standards. And so those are expected practices. The three inner circles are the competencies, which means the knowledge, skills, and attitudes for home health, public health, and now we integrated nurses working in family practice. And the competencies are the knowledge, skills, and attitudes for the expected practice of community health nurses, or the knowledge, I should say, knowledge, skills, and attitudes for those three particular areas. And at this point, those are the three areas in community health that have competencies. The nurses in family practice are just completing theirs, so they're not quite public yet. They're going public very soon in the new year, but the other two have competencies already defined. Next page or slide. And this nice visual likewise kind of gives you an overall perspective of the standards, in the sense the first three, the purple, are what community health nurses are all about. We're all about health promotion. We're all about prevention and health protection. And third, we're all about health maintenance, restoration, and palliation. How we do it are the green standards. We do it through professional relationships. We do through capacity building, through health equity, through evidence-informed practice, and professional responsibility. Next slide. Oh, can we have the poll? I think back up. I think the poll should be in here. So in your opinion, what is the most important benefit of the standards to you? And here's some choices. And if you could tell me, go ahead and respond to these choices.
And just to jump in here, Ruth, participants are allowed to select more than one response.
Yes. So we'll just give you a few minutes to complete, and then as you saw earlier, we'll get the results to get a sense of your perspective. Okay. We should probably be getting that fairly soon in terms of what we've got. So moving on, interesting. So clearly you can see defining scope of practice is a big thing that people are viewing, are the benefits, and that is true. It defines our scope of practice. And along with that is the setting expectations, and it inspires excellence. And also being used for professional development, and certainly in terms of informing certification. So thank you for sharing those. So moving on, that's really captures it well as we look at this slide. And it is intended that the standards would address all of these 5 areas. Inspiring excellence, they are the foundation for certification. And as you know, the certification, and I think this is an important distinction to make here, these standards are meant for after 2 years of experience. So they're not entry-level expectations for practice. So when nursing education uses it, it's more for awareness than expectation upon entry into practice for the students to be able to achieve this. Because for certification, as you well know, you need a 2 years or more of experience to be able to apply for certification, which these standards inform. And so it sets expectations for safe and ethical care. It defines the scope and depth of practice. It supports human resource management and also strengthens education in making students aware they exist, and certainly professional development with any community ed or continuing education programs, as you heard earlier. Thanks. Can you move on? So just to give you some insight into the process we did. So the standards have existed since 2003, and we have now modified them. We modified them in 2011 and now in 2019. And the purpose of the 2019, I mean, the currency is critical, but the expectation also is from CNA. All certified specialty groups have been expected to update their standards, and now the expectation is every 5 years. So obviously, given that ours were done in 2011, we were due for an update. So what we're going to share with you is the process as an organization we went through to update them. And we are in the midst of publishing this as well, which will give other interest groups and other professional specialty groups an opportunity to see the process in detail, what we did. So we first of all did a literature review and identified what potential gaps there could be. And we use this framework in our scoping review, Arski and O'Malley's framework. And we're just working on a publication and completing that process as well further. We also did a focus group. We thought it was critical using a World Cafe model at our conference in 2018, where we really wanted to hear from all community health nurses attending just what their thoughts were related to each of the standards, what they thought was relevant, what they thought needed changing. So that was an initial input and getting direct contact with community health nurses. And then we formally went into a Delphi process. So using the literature, using the focus group results, we then looked at each existing statement in 2011 and looked at modification of the wording, and either looked at seeing redundancies and removing redundancies, or we looked at rewording or adding based on it. We developed then a survey with including the revised statements, and through a snowball sampling technique in round 3. So we had 3 rounds actually. First of all, we had an expert group make the revisions, initial draft. Then we had an advisory committee with the CHNC who reviewed those revised ones. And then we moved it into round 3 to community health nurses across Canada using the snowball technique as mentioned. And here we gathered opinion from experts, community health nurses, through this particular questionnaire. And then through a consensus, and we deemed consensus was achieved when greater than 80% for important and essential to practice was determined in the survey. And if that was achieved, that statement was accepted. And we used multiple ways of getting this information out by email, website, and Facebook. Next slide. And so what you can see in this slide is the changes. So in 2011, we had 7 standards. And with the revisions, we in fact increased to 8 by adding a new standard, which was number 7, evidence-informed practice. And then we modified the actual domain title and gave it a new name of number 6 and changed it to health equity. So that's a bird's eye view. The remaining was maintained in terms of the domain title. And so you can see no changes in the other, and that's why they're in black. Next slide. And the other thing we felt was critical was in the 2011 version, we integrated the new community professional practice model, and we just had the written components. But since that time, since 2011 and 2013, we categorized those components into these 3, or you might say 4 areas. Obviously, central was the client, and then we had community health nurses and systems, and we put those particular components under that category. Then another category was community organization. We had those components identified under community organization, and then we put the remaining components under community health nurses and nursing practice. And this was important that this be updated in our standards. So moving on to the next slide. So just to hone into it, as you can see, the very center of the visual, and that was also the other addition, was, if you recall, for those of you who know the 2011, or the 03, I should say, version, our original version, had, as many of us knew, the spaceship. But we realized as we modified the standards in 2011, that spaceship really didn't define, it was just a visual representation, but it didn't really define what our practice model was. So we then took those components that had been informed by the literature and developed this new visual. It's what you're seeing. So in the center is the client. As you can see, individual, family, group, community, population, and system. And then you see the next circle, the green section, and that was the community health nurses and nursing practice. And embedded in that category was how we defined community health nurses, theoretical foundations, the code of ethics, values, principles, professional regulatory standards, and then the community health nursing standards and discipline specific. We felt that was those particular components of our professional practice model that needed to define who community health nurses were and their practice. Next slide. And so you can see in the orange section, that would be community organization. So it's community health nurses. The other aspect of the model was capturing this cluster of how we have professional relationships and partnerships and how that's defined. There's management practices that are all unique to where we work, and delivery of structure and processes are all unique. So we categorize that under community organization. And then the blue, both in terms of the components and around the circle, looked at other factors of our model related to government support and determinants of health. So because this was well articulated, we wanted it really clear in our new standards. That being said, these components have not been revised in the 2019. All that we have done is informed the categorization of them and the visual representation, and really encourage community health nurses to use this framework to understand their practice. And nurses are telling us that this has happened, and we do have examples of how that is happening. Next slide. So what I'm going to kind of walk you through now is just highlighting some standards, and I see my time and I'm going to hone into that a little bit more. So first of all, the standard 1, there's 8 indicators, and that's overall really looking at health promotion based on the Ottawa Charter that applies to individuals, families, groups, communities, populations, and systems. Next slide. And what you see here are examples that we've tried to pull out, and I'm not going to, you can see for each of the 3 categories or 3 areas of practice within community health nursing. And this is helpful in terms of how you can perhaps use this slide when you're doing continuing ed, when you're doing interpreting and defining our scope of practice. Here are some examples in each of these areas related to health promotion. Moving on. And the next standard was prevention and health protection. It has 9 specific indicators. And I meant to highlight some of that. And for instance, what comes through here, what was new, I wanted to mention, was that we included the appropriate levels of prevention, and we included 5 levels, which is new. And that's an expected practice that is important for community health nurses to now consider this new area that many of us were even new writing this and saying, oh, we need to include all this. The other part, as you will see in the definition, is the socio-ecological model. That we felt was really important to embed as well. So I know some of this language, you may say, oh dear, I don't know this either. That's what is new in here, is also the glossary, which we'll touch on later. So you know what we mean by this. So the next slide. Again, we've given you examples for each of the areas of practice, and I'm going to kind of go through this fairly quickly, because I'm concerned about the time. So moving on to the next standard, and I'm just going to highlight the changes. So the next standard, next slide, is about the 3rd standards around health maintenance and restoration. And we found in the 2011 standards, we really needed to pull out this aspect of nursing practice. And we pulled palliation out more clearly, terminal illness, end of life, because that was what the literature was saying and community health nurses were saying. And so our statements are more clear. We also integrated very strongly the need for integrating cultural safety, cultural humility processes. And in fact, you will see the whole thread of cultural safety and cultural humility in almost all the standards. And also the integration of recommendations, which are part of what I've just said, of the truth and reconciliation. One of the big things in revising the standards was, in fact, this part of integrated Indigenous ways of knowing, Indigenous health and healing, so that as community health nurses, we were integrating this in expected practice. Next slide. Again, similar model as the others. We've given examples of how each of these areas of practice apply this particular standard. Next slide. And this is the fourth one. And it really builds on professional relationships. And again, 12 indicators. So it's a big one here. And I think what I'd like to highlight in this particular one is that we integrated what was new are the national interprofessional competencies. That had not been embedded, but if we're looking at professional relationships, it's both with clients, no matter what level, but it's also about interprofessional. And so we really embedded that piece and the whole concept of self-determination. Next slide. And again, some examples of professional relationships and the expectations or examples relate for each of these three areas. So I'm going to, Ali is going to take it from here. So go forward.
Okay, next slide. Thank you everybody for joining us today as we go through some very important changes in our community health nursing standards of practice. I'm just going to pick up on standard number 5, which is capacity building. And basically, with respect to this specific standard, we want to make sure that nurses have the ability to partner with their clients, be it individuals, families, communities, systems, structures, to promote capacity building and to recognize the barriers to health and mobilize and build on existing strengths. The one component, number 8 of the 17 indicators I wanted to highlight, which is to enhance the client's ability to recognize their strengths, their challenges, causal factors, and resources available that impact their health. This again is another big standard with 17 indicators, and so I would urge all of you to make sure that you're reading through each specific indicator to make sure that you're able to align in some way, shape, or form to your nursing practice. Next slide, please. Here again, we've got 3 examples for practice for capacity building. An example here is a public health nurse who works as a partner with a health action team in a high school to mobilize stakeholders to identify the community's strengths and needs and prioritize, plan, implement, and evaluate the growing vaping behavior among youth. Now that's pretty current and recent, and so I'd like you all to think about what it is you can do in terms of capacity building given the current contextual settings that you may find yourselves in. We've got another 2 there that I'll leave for you to read through yourselves. And I'm mindful that we only have half an hour left, so I'm going to be moving on to the next slide. Standard number 6, again, 15 indicators. We've had a name change here from access and equity to health equity, and that was done very deliberately to bring the focus of your attention onto the disparities in health status between various population groups or communities that you may see. I want to draw your attention to number 5 of the 15 indicators, which is the community health nurse participates with community members and advocates for health in intersectoral policy development and implementation to reduce health equity gaps between populations. So that one again is new there. And just to make sure that we're focusing on what it is we can do as community health nurses to advocate for groups who are either marginalized, stigmatized, or at risk or rendered vulnerable due to inequities that we're seeing at the societal level. Next slide, please. Here again, we've got a few examples from practice, and I would like to advocate for the second one here, which is a nurse in primary care refers, coordinates, and often facilitates individuals receiving financial assistance for drugs when completing required government forms. So this is about access to prescribed medication, and we see certain conversations happening at our federal level in relation to this as well. So I would urge you to think about what role you could play in part of that process. Next slide, please. This is our new standard, evidence-informed practice. It has 6 indicators, and I would like to highlight number 4 of the 6, which is the community health nurse understands and uses knowledge translation strategies to integrate high-quality research into clinical practice, education, and research. One of the reasons why we wanted to highlight and bring forward evidence-informed practice in the new standards is to make sure that we as community health nurses are doing our due diligence to access the most up-to-date literature and find a way to incorporate that into our practice. Next slide, please. Again, we've got 3 examples, and I will highlight the third one here, which is home health nurses are working in their wound care policy and consulting best practice guidelines to make sure that they're using the best evidence to help improve the outcomes for the clients that they're working with in the home health setting. Next slide, please. Standard number 8, which is the final one, is professional responsibility and accountability. And we've got 14 indicators here, which again tells us that this is very, very important. I will highlight number 8, which is the community health nurse identifies and works proactively, either individually or participating in relevant professional organizations to address health and nursing issues that affect the client and or the profession. Next slide, please. We've got examples for you again here, and I will highlight the first one. The public health nurse is assigned to work in a needle exchange program based on harm reduction. He has difficulty accepting the tenets of harm reduction and uses reflective practice personally with his supervisor to understand and change his assumptions. So again, highlighting that it's really important for us as community health nurses to make sure that we're identifying and reflecting on our biases, our values, our assumptions, and making sure that when we're in situations where we're providing direct or indirect care, we're taking those attitudes, biases, values, and assumptions, and we're checking them, similar to checking in a code check, to make sure that they don't impact adversely the outcomes of the clients that we're working with. Next slide, please. The revised standards incorporate new practice expectations involving cultural safety, cultural humility, Indigenous ways of knowing, levels of prevention, disease management, critical appraisal, knowledge translation, interprofessional competencies, and quality improvement. These changes were made in the context of current literature and practice in Canada and our changing understanding of the complex forces that impact health. Our advancing knowledge enhanced by such important documents such as the Truth and Reconciliation Commission report has resulted in a current and leading document that will enhance community health nursing practice. So basically what we've done is we have included various components of the Truth and Reconciliation Commission report that has been embedded throughout the various standards to demonstrate how we are responding to this very important report in our context in Canada. Next slide, please. So here we've got new practice expectations, and I list them off for you. We've got cultural safety, and here are where you can find them within the standards of practice. We've got cultural humility, Indigenous ways of knowing, levels of prevention, disease management, critical appraisal of literature, knowledge translation of literature, interprofessional competencies, and quality improvement. Next slide, please. On this slide, we give you a way to differentiate between cultural safety and cultural humility. So basically, when we're talking about cultural safety, what we're referring to is the practitioner who can communicate competently with a client in that client's social, political, linguistic, economic, and spiritual realm. When we're talking about cultural humility, what we're referring to is an approach to healthcare based on the humble acknowledgement of oneself as learner when it comes to understanding a personal experience. And reiterating here that this is a lifelong process of learning and being self-reflective. Next slide, please. Here again, we've got, oh, sorry, can I get you to move back one? There we go, thank you. When we're talking about Indigenous ways of knowing, we're talking about the complex set of technologies developed and sustained by Indigenous civilization. What we mean here is we want to acknowledge and appreciate oral, symbolic knowledge that is transmitted through the structure of Indigenous language and passed on to the next generation through modeling, practice, animation, storytelling, rather than the written word, which is what we are more accustomed to in Western tradition. Next slide, please. And we've got here more terms that we define for you. We've got critical appraisal, knowledge translation, interprofessional competency, and quality improvement. Basically, we would like to draw your attention to these as well and to make sure that you're finding ways to incorporate these terms in your practice to be able to identify what it is you're doing and why it is you're doing that. Next slide, please. Ruth had mentioned that we have a new glossary that is attached to the standards of practice. Basically, this helps you to piece apart the terminology that is used in the standards and will help you understand what it is we mean when we're using these terms within the standards of practice and the competencies. And basically, a summary of the changes you will see on this slide. The Community Health Nurses of Canada have used an evidence-informed process to revise and update the standards of practice. This is the 2019 edition. The standards changes reflect current best practices for community health nurses in Canada, including new standards and new standard statements. The Community Health Nurses Practice Model was created in 2013 and is now part of the document in a formal way. And like I mentioned, there's a new glossary in addition to appendices that have been included to further enhance understanding of the key terms and issues described in the standards. These changes were made in the context of current literature and practice in Canada and our changing understanding of the complex forces that impact health. Our advancing knowledge, enhanced by such important documents such as the Truth and Reconciliation Commission report, has resulted in a current and leading document that will enhance the practice of community health nurses in Canada. Next slide, please. So what we're going to do now is open up the floor. We would like for you to pick one new area of the standards, and using the Q&A box, if you can provide suggestions of how these apply to your current area of practice. Okay, so we've got a number of questions here. The first one is, will the 2019 standards of practice be incorporated into the community health nursing certification exam this November, or will it be the set prior? So Ruth, my understanding is it will be the old standards that are going to be used for the certification exam in November. Am I correct?
Yes, that's correct. We're just in the midst as we speak. Over these past week or so, there's a team of nurses, community health nurses, who are in fact updating the competency for the exam certification based on these 2019 standards. So correct. This will not be implemented until next year as far as these new standards.
Okay, and Sima's got another question, and she's asking, is there a plan to incorporate these into the exam prep guidebook? The answer is yes, but again, this work won't happen until next year.
Correct. Yeah. Yeah, in terms of getting a hard copy, we do talk about it. You can purchase it, and we'll mention that later on in the presentation. And in terms of, yeah, I think valid point. We've had a question here that the examples currently we have given, as you noticed, apply to those 3 areas of community health nurses, but a question is coming forward. Can we do this specifically for Indigenous communities? Excellent question, and that is certainly something that the Standards and Competency Standing Committee, who is in fact accountable for moving forward the dissemination and knowledge translation strategies for these new standards. And I think this will be certainly a recommendation going back to the standing committee to look at this. So thank you for raising that.
Great. Now, Deanne here is saying she can use the standards as part of her practice in disease management. So thank you for that. And Elizabeth says, in my role as analyst, research, and policy, I complete evidence reviews, rapid reviews, and facilitate discussions of the recommendations and implications for practice in our local setting. Exactly, yeah, you can definitely include this in your work in that form as well.
Good. Yeah, and Lucia is saying that we are planning to staff training about Indigenous cultural safety. The fact that this is incorporated in these standards really validates this for our nurses. So that, thank you for sharing that. It does, and it just reinforces our accountability in community health nursing to integrate. So thank you.
We see a few more responses here about how you can use them in your current practice. And thank you for sharing. We appreciate that. I'm just mindful of the time, and so I would like to move on to the next slide, if this is okay.
And we will give opportunities for open. If you have any other questions, we've given you some questions just to stimulate exactly what you've done, how you could use them or are using them. But we will open it up so you'll have other questions you may want to ask.
Okay, great. Thank you, Ruth. So let's take a look at how you can learn more about the standards. You can access the standards through the Community Health Nurses of Canada website. You can consider getting certified as a community health nurse if you haven't already done so. You can include learning objectives for your professional development for renewal of your nursing license. And you can also collaborate with interdisciplinary colleagues to identify ways that you can work together and collaborate. And for nursing leaders, we ask that you be knowledgeable about these new standards and model your behavior accordingly. We also ask for you to support colleagues, those working under you, with you, beside you, to find a way to collaborate and advocate for incorporating these new standards of practice into your nursing. Next slide, please. Ruth, do you want to speak to this one?
Yes, certainly. You can get access in a couple of ways. It is online if you go into CHNC website, and it's not downloadable, but you can certainly visually see it. And so it is free access that way. It does have read-only, so just note when you're looking at it. You can also purchase it. And so that's another part on the website. If you go in and purchase it, and you can get hard copies, and it does sell for $25. And and we do have it in French and in English. And I think we didn't acknowledge at the beginning, which we ought to have been, that there was funding available to translate it. So that, yeah, and we just want to acknowledge the Government of Canada to support that translation. So I think we can nicely go in at this point, perhaps. Yeah, before we go into the next slide, are there any other questions? And enter them into your Q&A that you may have. And then before we go into the poll questions, do you have any questions about the standards, about the process, about some of these applications, or how you could use them that you're not using? Suggestions how they could be done?
Okay, so Roseanne has a question here. Can we attempt to make the examples for the standards 1 to 9 have the same theme? So I'm not sure what you mean by that.
It's a good question. I'm not yet. If you're able to send us some feedback, what you mean by that in terms of the examples, that would be very helpful. Here is a poll, so feel free. I see we've also got some other questions. So
before we get into the poll questions, I just wanted to take this opportunity to thank both Aaliyah and Ruth for such an engaging presentation. We're really grateful, and obviously there's a huge number of interest in these standards. Before we move on to the Q&A period, we'd like to ask that participants answer a couple of short survey questions, which is the poll that you're seeing now, about today's webinar. And then the poll questions, so whenever you're complete, and you can share the results of those afterwards. I know we've already kind of started with the discussion with the Q&A box. So please feel free to type in your questions into the Q&A text box, and we can continue on with the Q&A.
Okay, thank you. Shelley is asking, is it open to RNs in primary healthcare in April of 2020?
Do you want me to respond to that?
Yeah, please.
Yeah, if you're referring to the standards, they're available now because they exist. As far as the competencies for primary health care, or I should say RNs in primary care, is I believe how the plan is, they are going to be available in the new year. I'm not sure about April, but they are currently just finalizing the dissemination plan. So I'm not quite clear in their approach yet, but it will be certainly released in the new year. They've gone through an extensive process, so it's really quite exciting to see that.
Great. Okay, Catherine is asking, how can nurses learn more about safe cultural care for Indigenous populations? So basically, I think this is an excellent question. And I think it's going to take a very, very long process in terms of how we as Canadian society engage with Indigenous populations in a different way. So I would actually urge you to do some reading, connect with your local Indigenous communities to see what would work for them, and to engage in a lot of capacity building sessions yourself in terms of communicating with Indigenous populations. Ruth, do you have anything else to add for that one?
I think that's you've suggested some really good strategies. There are various training programs that are available as well around Indigenous health and nursing. And I think, yeah, whatever opportunities and resources exist would be good. So we see this next question, Lucia has mentioned, yeah, we did want to highlight that standards are meant for 2 years out, and I know some schools of nursing have embedded it into evaluation forms, which is putting an expectation a little higher. What we could suggest is that, as we mentioned, the 3 areas most common are the 3 areas: home health, public health, and now RNs in primary care. At this point, there are the COSN public health nursing discipline specific competencies that exist that are entry level. So that will address preparation for public health nursing as part of community health nursing. The actual competencies for RNs in primary care are at the entry level as well. So those can be used to inform curriculum. The home health ones at this point, I believe when we wrote them, were not entry level. They were more after some years of experience, couple of years of experience. So that will give you some support in moving forward and I should say that I'll frame that as well, the national entry to practice competencies. And why I say that is when we develop the public health nursing ones and the ones for primary care, we looked at what was in the national competencies for entry to practice and pulled out what was not clearly articulated and articulated the knowledge, skills, and attitudes related to these areas, i.e. public health and primary care, competencies for those areas of practice. So I hope that helps.
Next question here. Can you please elaborate on the 5 levels of prevention? Thank you for that question, Muna. I'm going to elaborate on that because as a member of the advisory group who got helped to guide the direction of the changes, that was actually something that I had pushed for. So I'm going to explain briefly the 5 levels of prevention. The first is primordial, and we're talking about the types of prevention conditions that would enable the risk factors for the disease from developing. So basically, these are things that come at the policy level. It's the initiatives that are established. These initiatives basically establish the conditions, the actions, the measures that minimize hazards to health and therefore inhibit the emergence and establishment of the processes and factors that known to increase the risk of the disease developing. Let's talk about primary next. So basically, at the level of primary prevention, we're talking about the impact of specific risk factors and how we can lessen that in the reduction in the occurrence of incidence of disease. Primary prevention initiatives are those that interrupt the chain of causality at the point or points before a physiological or psychological abnormality. Okay, so that's primary. Secondary, we're talking about reducing the prevalence of a disease by curbing its duration. So things like early detection, screening, that's population-based. That is an example of secondary. When we're talking about tertiary, we're talking about initiatives that soften the impact of long-term disease and disability by eliminating or reducing impairment or disability. And finally, the 5th one, quaternary, we're talking about the actions that are taken for identifying individuals or populations that are at risk for over-medicalization. So thank you for that. If you'd like more information on the levels of prevention, Community Health Nursing, A Canadian Perspective, the 5th edition is now in circulation. I am the lead editor of that textbook, and we have threaded through the 5 levels of prevention in every single chapter. And so you're welcome to refer to that textbook as a source for more information.
Great. And
Thank
Natalie,
you.
yeah.
Oh, hi, Ruth and Elliot. Just in the interest of time, I don't know if we'll have an opportunity to get to any more questions, but there obviously is a great number of interest and a number of questions left. And so we will be sure to ensure that our presenters receive your questions and are able to respond to them after the presentation as well. But I just wanted to say,
sorry, how many more do we have time for?
Maybe just one more.
Okie doke. Okay, maybe we could just, somebody has asked, which I think is helpful for other people to know, about the use of some of the diagrams in today's presentation. This presentation and the recording will be made available. And yes, certainly you can use some of these, and the idea, CHNC was hoping to have the presentation available, as I mentioned at the very beginning, as a tool for continuing education, orientation, whatever. And so, yeah, we will make sure that that's available on the website. So you'll have it, but you'll also have the recording of today.
Perfect. And thank you again, Leah and Ruth, for your presentation. For all of our participants, we hope the session stimulated your thinking about community health nursing and standards. You can access the recordings of our webinars by visiting CNA's YouTube channel, and all those that have registered will receive a link when it's available. If you haven't already, please consider registering for the next webinar. What is your role in the fight against antimicrobial resistance, which will be held on Monday, November 18th from 12 to 1 p.m., which is during Antibiotic Awareness Week. Thank you, everyone.